And one of the first risks we see is also an opportunity, and that is the health worker shortage. I've already this evening had a couple of conversations on the health worker shortage. Back in 2008, we produced a briefing on the subject, and it was subtitled, "An Investment Risk or a Security Risk?" Our thinking at the time, and still today, is that the health worker shortage is an enormous challenge that has no end in sight. Now, you all know better than most about the statistics and the realities of the health worker shortage. People are working with this on an everyday basis. But what we look at is the impact beyond the actual shortage. And what we see is a shortage that may actually threaten national security for some countries. For instance, in September of last year, the Malaysian Minister of Health put out a call urging medical specialists to return home to show their patriotism. Recently, Cairo banned doctors from working in Saudi Arabia. It was a short-term ban, but it was a use of medical workers for political reasons. Ghana claims the UK is crippling their healthcare system. They're pulling so many of the professionals out of the country, it's crippling their healthcare system. Doctors recently were injured in Algeria protesting their compulsory service. And most recently, a study showed that medical tourism was having a negative impact on Thailand's medical worker staffing levels. And what we see is the growing medical worker shortage increasing medical costs and eventually acting as a disruptor to personal income. And that's the national security risk that we're talking about. The last sentence in the briefing reads, "Assuring the supply, the human reserve of knowledge and skills would become necessary for any strategic investor." So I ask tonight, how are you planning for the health worker shortage as you begin to cross borders? We know Manipal, Apollo, and many others are actively engaged in developing this resource. It's a great opportunity for the long run.